Screen sharing. The first question on Telegram. A patient attends emergency appointment with fractured twin block appliance. I think we discussed it yesterday. Even yesterday we discussed it at the end. And we discussed this many times. You take an alginate impression and send the appliance for repair. You are concerned about recently several appliances which have been repaired but do not fit properly. What is the most appropriate way to prevent this? Ideally, it should be more polymer powder, right? You cannot only do it with polymer powder, or you can combine it with light pure. Hmm? Yes, MOth exam party discussion group, Telegram. Ideally, it should be more polymer powder. Use of polymer powder and light pure. Yes. Light curing. I mean, or use.
Sir, why we can't go for E option?
I told you that ideally it should be more polymer powder added to monomer, right?
Yes, sir.
Or use of polymer powder and light curing with the monomer.
But the monomer is responsible. Okay, with the Thank you.
Sir, if you go through BOS module,
Yes.
material lines that you should go for powder only.
Yes, it's powder, but it should be added in the monomer. Can we do like what we do with the powder?
Yes, exactly. The current powder should be higher according to them in scenario.
Sorry, there is a lag.
Yes, you're right. The powder more be added to the liquids.
Yes.
To balance out this imbalance between powder and liquid.
Yes. Even the light have this shrinkage.
Excuse me, sir.
Yes.
Sir, if you're using the light, so that will be the same, that is the LED light, and with the same wavelength that we use for the composite curing.
Frankly, I do not know the wavelength correctly because I'm not going for it. So you have to see the literature for this. But yes, they use the same lights, right? Because the lights also come in different wavelengths. But I think they use the same light as we are using for this composite curing. Dr. Junaid thinks that it should be the powder only. Added to the more powder, added to the polymer. Ideally, the question should be high powder to liquid ratio. No, I said that like what previously selected, more powder and light pure. Because when you light pure, there is shrinkage, but immediately like what everything is accommodated. So a liner case, a rotated central, and they're given a rotation attachment. And if we see the incisor, it will cause the mesial in, like what they are doing a mesial in rotation. Mesial in rotation. Self-ligating bracket in which the clip is opening on the incisor side. You have bonded brackets pictured in opening the bracket on the patient on the upright central incisor. To check the excess composite incisor to the bracket. Yes, sir. And this picture is more clear. Baby was evaluated using ultrasound during mother pregnancy. The sternum was found pressing on the chin and the mandibular body upon examination. What condition going to happen? Peri-Robin sequence. It's a classical for Peri-Robin sequence. Extraction of the low fast permanent premolar with class 3 elastics. It might be the, I don't know. A boy 12 years attends with his parents to an orthodontic with cleft palate, malpositioned teeth, enamel hypoplasia, dental midline shift toward left. On examination, there was a bilateral maxillary and mandibular hypoplasia, hearing loss, malar hypoplasia. His hands and arms are normal. The patient is mouth breather with multiple case teeth. What is the? So it's not amifacial microsomia, not a Pitt-Robin sequence. It can be a Tricher-Cullen syndrome. There is no hand anomaly, it's not a Apert syndrome. So it's option C. 30 years female with class 3 with mild crowding presenting for orthodontic treatment. Orthognathic surgery was decided, and this is a symptomatic tracing, which I do not see. What is appropriate orthodontic before starting surgical treatment? Non-extraction. So we do not see the X-ray. 30 years female with mild crowding presented for. So if it's 2 to 3 millimeter, depend on the incisor inclination. If they are normal, it's a non-extraction. Yes, but it's mild crowding.
So we can non-X and mild crowding.
Yes. It depends on the level of compensation.
Yes.
In surgical case, I don't know what is the present inclination. So without the inclination, we cannot decide this case. Might be the like what compensation is too much, like but it's already like what 120 degree and everything. And it's mild crowding. So we need extractions then. A 25-year-old female was undergoing orthognathic surgery examination class 3 due to large lower jaw and anti-open bite, which increased vertical proportion. A posterior cross bite was also present. It was decided to go for orthognathic surgery. Still, we haven't found this reference. It's a double jaw surgery,
Yes.
right? So we'll try to update it. Patient presented to clinic for orthodontic treatment suffer from TB sensitivity. It's a commonly asked question. After burning, skin rashes, you give oxygen and he does not improve. What should be given?
B.
It should be given adrenaline, and it should be 1 in. Okay, a superimposition question. Your attempts to start removable aligner, the malaplane have
Sir,
been.
this is actually
Yes, go ahead.
so this is actually 0.5 ml, not milligram.
Let me search. They've all given milligram. Yes. Thanks a lot. I think Fran is in exam mode these days.
Very much, sir.
Yes. A 21-year-old female attends to removable aligner treatment. The manufacturer had recommended the following tooth movement over 25 aligners. Like what? It's a superimposition. I don't know how this. What is the most likely reason that the upper left fast and the second remain blue? Which seem like, but then they can be the pontics, like, but they are not moving these teeth. The molars are missing, have not moved in position. They give the same color for pontics and are not moving, right? Or the implants.
So the molars are implants?
They give the same color, like, but what we've seen there in the Invisalign, they give the same color. The options are correct, at least what I know. Alarmius female presenting with overjet, sway overjet, anterior growth rotation of the mandible with normal inclination of the lower incisor. What features is most likely? It's anterior.
Anterior growth rotation.
Sway overjet is least likely with anterior growth rotation.
Anterior growth rotation. Anterior open right is likely because
Yes, but even in the question, sway overjet is also might be in some low angle cases. Okay. Lower anterior spacing, upper anterior crowding, competent lips, anterior open bite E. Upper anterior crowding can be present. Anyway, option is more likely. Even retrogenia cannot be present. What is the least likely? Even a tinge of, yes, but
Doctor, we solved this one before. We chose anterior open bite.
yes. I went for anterior open bite because anterior open bite is least likely. A patient attends with severe gingival inflammation as shown in the picture. What is the line of treatment? Prescribe metronidazole tablet. It's, I think they're taking it as a NUC.
yes, sir.
So it's metronidazole.
Debridement and then prescribe.
Even in a NUC.
Yes, sir.
So first line of treatment A, then like eventually C.
Yes.
What is the common treatment of adult patient with severe increased vertical height? Leafort.
Septal infection.
Yes. D. Counter problem solving the cost, gather staff and exploring one of the staff. Discount of 3% from staff, incoming and out notes, pharmaceutical. Gathering staff and expelling one of the staff. That is the good. Reduced fees. Counter problem, solving the cost. Like what you have to counter a problem that is related cost. Gathering staff and expelling one of the staff. I can do it with PGs. Yes. Reduce fee. Obviously, that is not an option. The first is not. Discount 3% from the staff. No, you cannot ask them. Incoming and outbound notes. Pharmaceutical companies and deferred payments. I don't know, frankly. Incoming and outbound notes. Ali, you should first, like, but the question we know that you have to take care of the stock that why are these expenditures and like what you have to decrease your expenditures or see the stock first that why it's happening. "13 years female we fixed for the correction of mild class 2D1. She traumatized her upper central incisor 2 years before starting treatment. These stages sustained large enamel dentine fracture which were restored with composite resin restoration. On attendance today, she reported that the upper left central incisor had tender on biting. What is the most appropriate management for this patient? Like what first, like what go for the vitality testing?
Yes, sir.
Right.
Option B. To perform vitality testing.
And take periapical radiograph if the tooth is non-responsive. Alginate is used for the impression in 16% calcium phosphate. Decided that it's used alternative. What would be effect if the calcium phosphate were reduced? So if reduce it, then the setting time would reduce. Previously we saw it increase setting time, but the working time and the setting time would be reduced. No effect, increased setting time of the alginate, decreased setting, E. Adult patient require OPG for the treatment planning. What would be the effective dose and current required for OPG? 70 kV with 10 milliampere. Yes, that is the most close.
7 to 11. 7 to 1.
At the end of appointment, the mother of 16-year-old female asks her daughter to leave the room. The mother informs the dentist she suspects. Advice to consult with the GMP, contact the police, advise not to do anything, ask the mother not to worry. I think like what we yesterday decided B. B. Advice to contact the child support.
The mother informed the dentist that she suspects her child is having self-soothe. The mother should talk to the child first.
Where is option?
It's not there, but
yes, the mother should talk with the child. If this option is not there, then it's the child support.
To consult with GP. Then the second option
is a general medical practitioner. So first, like what they should general medical, either it should be a psychologist, right? Not the medical practitioner. It's self-harming child, so might be child support. Because ideally they should like would have a talk with each other. Division of secondary palate take place in minutes. Elevation minutes, fusion in weeks. 1 minute, 1 hour. Okay. It's not written there, but anyway, it's minute A. 9 years.
Doctor, elevation
yes.
You said minutes and fusion days?
Weeks. 2 weeks, like 1 to 2 weeks.
Ah, weeks, not days.
No, not days. Fusion. Yes. No, like what they elevate and from. Yes, up to. Yes. So it in weeks.
Okay.
6 to 8 weeks or 2 weeks. They're saying that in basically it's 6 to 8 weeks. I think the duration is 6 to 8 weeks. Actually, it happened in 2 weeks. It happened in the 6 to 8 weeks, but the duration is 2 weeks. We can check, but I think that it happened in 6 to 8 weeks. I think the fusion occur at 9 to 10 weeks. The age of fusion, they also ask. Okay, we'll check this, but it is in weeks. In 9-year-old patient with fused central incisor who is mixed dentation, what would be the most initial radiograph? OPG. Shadi Samir, you plan transplant lower 5 in the place of central. What is the root formation stage optimum for success? In Bristol notes?
Yes, I think it is, but the best ideal is P4.
Okay, let's check Bristol notes. Because it's a wide range when it
but they have written it is P4, then it is ideal. I think we checked it from some article as well.
Okay, transplant when the root is 2/3 to 3/4 pound to allow continued return, good long-term result curated. So both are mentioned.
Yeah, but
Okay, stage of root development is the most important factor in determining pulp filming. Ideally in 3/4 to 4/5 complete in the last line. C. 9 years attends for assessment. He is in the mixed dentation with permanent incisor and the first molar erupted. His dentist discovered an unerupted inverted mesodens on occlusal radiography. We have previously seen this one, and there was an X-ray like what upper occlusal, and the mesodens was doing nothing, like what the central saw erupted. We went for monitoring that case. 9 years female presented with a dental clinic complaining from retained baby tooth. A radiographic of unerupted central incisor shows incisor edge of tooth in the near crest of the bone.
Extend the retained tooth.
What would do next?
The retained tooth.
Present with dental clinic from retained tooth. Yes, we have to extract it. Offer no treatment. Bond with gold chain. Extract the central incisor. Extract the retained tooth and wait. Okay. E. So we solved it many times. If you're doing a growth modification, class 2 growth modification, because it's not mentioned, right? The functional appliance, because it can be in class 3. So if it's a class 2 growth modification, and if you're comparing it with the Scammon curve, you are underestimating the mandibular growth and overestimating the maxillary growth. And if these options are given for maxilla and mandible, then mandible is more important than the maxilla, right? So this will actually underestimate the mandibular growth. D. Eight-years-old attends with an unerupted upper first molar on the right side. There was less than 1 millimeter resorption adjacent E, which was with no mobility. Review and yes, they are reversible mostly. A. 11 years female present with sway jet anterior growth rotation of the mandible. We already solved this.
What is the answer of the last question?
Review and monitor. It's written based on loads. Right?
Okay. Okay.
Because for less than 1 millimeter or 1 millimeter with no asymptomatic, these are reversible mostly. While starting this spectrum function by using data from patient notes, the first step would be sample size calculation. Then you go for the ethical approval or something. A. Abdurrahman, someone said that in patient notes mentioned that it takes minutes or hours. Okay, we'll see it at the end. You take PVC impression for sending. So for the PVC impression, the best evidence is 7 days.
7 to 8 days. Self elevations. Yes.
No, for fusion.
For fusion, it's 6 weeks.
Elevation is 7 to 8 weeks.
Self elevation
Take place in minutes. The question is take place.
So we went to an article. In the article, they have written it's in minutes. And even in that article, the fusion was 2 to 3 weeks.
The question is about, it said that minutes to hours. It's written in patient notes.
This is what I'm saying. In that article, the elevation was in minutes and the fusion was in 2 to 3 weeks. This is what you were saying earlier.
They said that for the elevation, it's written in patient notes minutes to hours.
No, it's not written. There is in patient note, there is no such thing written.
For fusion, like what, that takes weeks.
Yes, it is.
A new Australian nurse came to work in your clinic. What is the most important vaccine? BCG. Because even in Australia, they have hepatitis B virus vaccination. C.
BCG.
Yes.
After 18, after 64,
We decided 7 days.
14.
7 days. We decided
Doctor,
because it's written 7, 12 days. And Dr. T came up with the reference 7 days. So most of the places, like in the books, in some books. Sorry.
Doctor, I think we
मैंने
have this
उससे कहा आप ये
question.
बता दे भी तुझे सूट कर रहा नहीं कर रहा जवाब देने की तो तमीज ही नहीं है ना जी अपनी बेटी
She's talking with a patient, I think, or with someone. She can also
Doctor, I
take a
think
stop out.
Doctor, I think we solved this question 15 days.
It's initially 15 days, then we decided that it should be 7 days, right? Because in books like what, it's written like what in some books it's written up to 15 days, 2 weeks, right? And in others they say 7 days. To be on the safe side, we went for 7 days.
So you shared article for that.
Okay, and doctor, for the vaccination, why we didn't choose hepatitis B?
Because they already got vaccinated in Australia. They're not coming from Congo or something like that.
Sorry, ideally should be written came to work in UK.
Yes. So they asked them for BCG vaccination because it's not routinely given there. Most of the dentists or the doctors who go there have all these vaccination. So they ask for this BCG vaccination mostly.
Mm-hmm.
9 years patient presented with retained low left E and missing low left fiber is below the left E is below the cemento-enamel junction, and it has a dull sound on percussion. So extract it.
Yes, then allow it.
So A. Class Rodito. This patient shown above, it is decided to correct the maloclone with the help of extraction of a first premolar. However, you fear that overbite will not be corrected. So I do not see a pec lateral. There is no bolt-on discrepancy here. You fear that the overbite will not correct complete. What is the side effects? Compromise, I guess it was written slightly class C, molar and canine dilation. No. Bite settling issues. We can settle the bite. There might be space remaining distal to the laterals, or you can mesialize them. If the overbite is not corrected, what are the options? Space left distal to the lateral.
Yes.
If you are using a one-step retraction, space left distal to the canine.
Yes.
And if space is less left, then there would be some settling issues. Or some people like to close all the space then and cannot finish in a class 1 mode relationship. A lateral open bite is not an option. Incomplete correction of curves B. That is for overbite because overbite is not corrected. So the curves B won't be corrected then. There would be remaining. Bite setting issues, compromise, I guess written slightly class D. No, I don't think so. It can be D then.
Yes.
Or incomplete or jet correction. OJet is corrected. If the overbite is not corrected, OJet is always corrected. It's a space issues we suffer with. So might be D. Beta and TMA, which property allow them? It's a formability. Start in an orthodontic case. Few months back, when you started this case, patient had caries in the upper central incisor, which was fitted, but now patient developed abscess. On periapical lesion was clearly seen. What would be your next step to manage the abscess? Yes, no, and place non-setting. It's written calcium oxide, but it should be non-setting. See. There's so many questions. Okay, we are almost done. The laser having high affinity for hydroxyl crystal and high affinity for observation, what is one of the following? I'll skip this. This is not a mouth question. Minimum accuracy is defined as, this is also not a mouth question, but when you go for 2/3 space loss, right? 75% space loss, that is 2/3 or more of the extraction space utilized by movement of the anchor teeth. The first one. 75%. How long palatal shift take place to fuse? Weeks. Okay, that is done. Okay, everyone, see you. If there's any question, just let me know.